Welcome to Winning with Annalee. I'm your host, Annalee Leonard, president of Mainstay Financial Group on the corners of Antes and Perry. As you know, we're always here to educate you. That's the biggest thing. You know, as long as you're educated, you then become enlightened, and then you're empowered to make correct decisions. This is a very important time for a lot of the clients that we serve who are approaching 65, past age 65. We're getting into open enrollment for Medicare. That section opens October 15th and it will end December the 7th. So you're not given a whole lot of time to make decisions. If you're like most people I talk to, as you get near that age, it's like this wheelbarrow of information comes to your door, and this book says this is the best, that one says this is the best, this one explains something one way, another one explains it the other way, and you look at it and you say, I'm more confused than I was before. So there was a recent survey done concerning Medicare, and more than half of pre-retirees said that Medicare was confusing, it was totally baffling. 2 out of 3 couldn't identify what part of Medicare covers hospital care. 3 and 4 don't know what covers doctor visits, and less than 1 out of 10 understood the benefits of Medicare Part C, which we call Medicare Advantage. So with all that in mind, I invited to come in with me today Dr. Joan Connell, who's my business partner, and Joan is in our business the Medicare and long-term care specialist. To me, that's how important this segment is. It's become so different from when I very first started in this industry. You need somebody who is totally dedicated to that and who totally understands it. So, Joan, thank you for taking time coming in today.
Thank you, Annalee, for having me come today. You know, this is my passion, Medicare.
I know, you love this stuff.
I tell people that's my passion, and they look at me like I have 3 heads.
Yeah, well, I look at you like that a lot. But
I know.
You know. So let's talk about Medicare, because I think people get very, very confused. I hear the terms Medicare, Medicaid used interchangeably. What is Medicare?
Medicare, very simply, is health insurance. It's government health insurance.
Okay.
For people who are 65 and over,
all right,
or for certain people under the age of 65 who have certain disabilities. We don't need to go into that at this point, but our primary focus right now are people turning 65 or those of us over 65.
Already over 65. So you said it is a medical insurance.
It's a health insurance, and it covers us for hospitalization, and doctors and outpatient kinds of things, all those things that affect us as we age, and certainly when we're younger too. But it's health insurance, but the kind of health insurance that's special for those of us who turn 65 and over. Primarily, yes.
Okay. So you said basically we sign up right at 65. So let's say someone is just turning 65. When do they go and sign up?
Well, the thing I tell people is you really need to start thinking about your transition to Medicare when you're about 64 and a half, all right? And even maybe a little sooner, because it's part of a total financial plan, as you well know.
Yes, I know.
You know, we'll talk about that in a little bit. But when people want to sign up for Medicare, they generally sign up the 3 months before the month of their 65th birthday.
Okay. 3 months before they turn 65, they can sign up.
Yes, yeah.
Okay.
Now, if somebody's born on the 1st of the month, they actually sign up 3 months before the month of their 65th birthday.
Okay. All right.
It's a little bit different for that.
3 months before birthday.
Yeah.
Okay.
But anyway, and you know, one of the things people get confused about is they say, well, I'm signing up for Medicaid.
No.
You know, right, and Medicaid is the health insurance that is there to help people who really can't afford to pay for their health care. But people do get Medicare and Medicaid mixed up, and it's understandable. It's so close in the way it's mentioned and talked about. So, but anyway, Medicaid and Medicare, two different things.
Two different things.
We're talking about Medicare.
Okay. And I personally kind of think of Medicare as the replacement to the health insurance I paid for on my own. You know, that all of a sudden between 60 and 65 becomes astronomically expensive. And people I know complain, oh, my premium is this, my premium is that. Well, compared to what you pay for regular health insurance, it 9 times out of 10 is a reduction in your payment.
I do, especially if people are paying for their own health insurance. They do. They at 65, they're relieved to go on Medicare because when we put the plan together, yes, it generally is less expensive with Medicare than being on private pay for health insurance under the age of 65. Now, one of the things I want to point out, Annalee, is we talked about when people sign up for Medicare, and a lot of people say, well, I'm still working.
Yes.
So what do I do? And the answer there is that most people, if you're working and you have group health insurance and your health insurance covers a group of more than 20 people, 20 or more, you generally, and you're going to continue to work, you generally are better off staying with your group health plan than going full Medicare. And that's kind of that's a very individual decision that people have to make.
I was going to say, don't you think that's something before people make that decision, they should come in and sit down and talk with you and let you run numbers for them to see which is better. Don't take it as a pat statement that if you run a group plan, stay on it. Come in, let Joan run numbers for you, and then we can tell you, yes, it's better to stay where you are, or here's the Medicare plan that suits you the best. And I think it's very important for all of you to understand that Joan works the way I do. If we don't have what's best for you, she's going to tell you where to go and get what is best for you.
Or if your group plan is better than
we're going to tell you to
the
stay
alternative, we're going to tell you to stay there. But a lot of people sometimes don't know how to make that analysis or make that decision, and that's the thing that we can help them with. And to me, that's a very important piece of what we do.
Sure.
Because we don't try to convince people, oh, give up your group and do this. No, absolutely not. In many cases, I say to people, oh, you're better off staying with your group.
Better off.
Most especially, one of the situations that happens is people will come, they're turning 65, and they have a spouse who might be 64. And didn't you just mention how expensive health insurance is for people under the age of 65? In many cases, and again, it's an individual thing, but that's something we look at. Are you better, first of all, to stay working for one more year so your spouse has your group coverage with you?
Yes.
Or is there retiree coverage that you could have and carry your spouse until they're 65 and then make another decision then? So there's so many pieces to this that...
Well, it's like everything we do, Joan. I mean, you can't say pat to everybody.
Exactly.
This is better for you, that's better for you. Everything is an individual situation, and you deserve to be treated that way. And, you know, we've always held to the thought pattern that being an independent allows us so many more advantages because we can be objective in looking and saying, well, you know, if you do this, this is going to be better, but wow, if you do this, that gives you a much better choice. If we can, let's go back to enrollment a minute. We talked about the idea of when I first turned 65, you know, the 3 months before, but aren't there, you've got a general enrollment, an open enrollment, a special enrollment. Now I'm confused.
And understandable. All right, I'm not going to deal really with general enrollment or special enrollment. That affects people in certain situations.
Okay.
Let's really talk about the initial enrollment, which is when you first become eligible for Medicare at 65. And by the way, that's another thing that confuses people, Annalee, because it used to be that people became eligible for Social Security and Medicare at 65, full benefits for so they coincided. Some people will say to me, well, I don't have to sign up for Medicare till I'm 66 when I become eligible for full benefits for Medicare. Well, obviously that's not true, because Medicare has always stayed at the age of 65. Whereas you can delay your enrollment into Social Security until any time up till 70?
Up to 70,
Yeah.
basically, and that again all depends on a person's financial status.
Exactly.
66 is term full retirement age, 70 is your maximum amount that you'll get. So depending on what you need, depends on which one you're going to take.
Exactly.
So, I've heard people say, and I know it's incorrect, but I think we need to talk about it, because, oh yeah, I'm going on Medicare, that's free.
Well, and that's always, it's a shock to people.
Sure.
It is a shock to people, except for the people who have been paying very high premiums if they had their own health insurance between 60 and 65 especially. Okay, those people are happy. Other people, they do think that, oh my goodness, well, I thought Medicare was going to be free. And it's true. Medicare Part A, which covers us for hospital and rehab type facilities, that is free. Because why? We've paid into the system through payroll deduction.
Well, it's not free, it's prepaid.
Well, yes, it's prepaid.
It's prepaid because
prepaid.
they've been taking that out of your paycheck, comes under the FICA section. That's part of what they take out of your paycheck every single time you get paid. So it's like you have prepaid a premium, but yet again, when you look at the cost of the supplements and everything, it's very low compared to what you would have.
Yes, yeah.
If you
and of course Medicare Part A, you kind of prepaid it like you said.
Yes.
Medicare Part B, however, is a premium every month that we have to pay for.
That we have to pay.
Yes.
And what we're going to do when we come back, I want to go more into what A covers, what B covers, and why we pay that premium and why supplements become such an important thing. Because this, and Joan has a wonderful way explaining this. If you've never been to one of her classes, you need to do that, because she talks about the 1-card, 2-card, 3-card system and how it all works. And people have walked out of that class saying, wow, for the first time, I understand how all this comes together. So important things as we age. We'll come back after break and we'll talk a little bit more about Medicare and its rules.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Mainstay Financial Group offers advocacy and personal financial guidance in a caring environment. That's the heart of our practice. At Mainstay, we're dedicated to exemplary service and a caring relationship with our client, not with a number. Plan for the future now with Mainstay Financial Services.
When you're finished with your food or beverage cartons, toss it in the recycling bin. Because every carton is recyclable and can be turned into useful paper products. Put your carton in the bin with your other recyclables and let them start a new life. When the contents are gone, let the carton live on. Recycle your cartons.
Welcome back to Winning with Annalee. I'm your host, Annalee Leonard, and I have with me today my business partner, Dr. Joan Connell, and we're talking about that wonderful puzzle out there that seems to have so many pieces to it: Medicare, Medicare A, Medicare B, open enrollment, general enrollment. Gosh, what happens when you're still working? What about your Social Security benefits? What about HSAs? I mean, we could do this for 6 weeks.
We
I
could.
think.
We have enough to last us for 6 months here, for 6 shows.
I mean,
we really do.
So let's go back a little bit. You wanted to kind of clarify a couple of things about enrollment, I believe.
I did. We talked about initial enrollment when somebody's new to Medicare.
Right.
All right. And that can take place anytime during the year when you turn 65.
Right.
Open enrollment is where we are right now, and that is from October 15th to December 7th. And that's when people who are already on Medicare can make changes to the way they have set up their Medicare benefits.
Okay.
One of the most important things that I tell people is many people, you mentioned the 1-card and the 3-card system.
Yeah.
When people have a 3-card system, they have a Medicare card, a Medicare supplement card, and a Medicare prescription card.
Okay.
And those people every year during this time should be looking at their Medicare prescription plan, because those plans change every year.
Yes, they do.
Their premiums might get adjusted, their coverages might change.
Or they might take medication off the list.
They might take medications off the list. All those kinds of things. Now, every year, if you're on a Part D plan, you get what they call an annual notice of change. And that comes from your company that manages that plan. You need to look at it and say, is this worth it for me to stay in this plan for the next year or not? And that's the value of this open enrollment period that we're in now, where people can do that analysis of their Part D plan and see, should they make a change or should they stay where they are? Because in many cases, people wind up paying more than they have to.
Than they need to.
And no one wants to pay more than we have to.
No.
For anything.
No. So let's go back to make sure I've got this together. Medicare A, we have prepaid. That covers hospital.
Yes.
B covers doctors, outpatient, and that NA, both if you don't get a supplement, has money, they have money you got to pay out of pocket if you don't have the supplement.
That's exactly right, because with each of those, A and B, there are what we call coinsurance amounts and deductibles.
Okay.
So people need to be aware of what those costs are and not leave themselves exposed to that out-of-pocket cost. And that's why people get a supplement, or otherwise known as Medigap policy, to pick up those amounts that Medicare doesn't cover.
Gotcha. Well, you know, it's amazing because when I very first started in this business, which now I feel like it's 100 years ago, but when I first started in this business, Medicare was so simple. I went out with one sheet of paper and I had the different plans across, and we talk about which plan fit the client the best, and then I would go and find which company gave them the best premium for that particular plan. But now you've got so many other variables in there now that they've added prescription coverage in. I know that was supposed to simplify. I haven't seen the simplification yet. So you've got to have, if you want to protect your assets, you have to have that supplement, and then part of the Part B deductible, part of the Part B, there's a premium that comes out of your Social Security, isn't there?
Yes, that's, we said Medicare Part A, you prepay,
Right.
but Medicare Part B, we pay every month.
Gotcha.
It comes out of our, if we're on Social Security, it comes out of your Social Security check.
Okay.
If you have delayed Social Security and you have to pay the premium, the government bills you.
Okay. But one way or the other, you pay for it.
Yes.
So A, we've prepaid. B, they take out of Social Security or they bill us. And then the prescription supplements.
The prescription plans, also from private insurance companies like Medicare supplements are, and in most cases, those premiums can also come out of your Social Security check. That's what the vast majority of people do, if they're on Social Security.
If they're on Social Security. So if you're still working, you get a bill.
You get a bill. And by the way, Annalee, let me just clarify one other thing that is really important for all of you out there. If you are turning 65 and you are not on Social Security, not getting your benefits, you've delayed, you must be proactive and sign yourself up for Medicare during that 3-month period before you turn 65. A lot of people miss that, and right now there's an initiative in Washington saying that they want the government to notify all of us who are turning 65, if you're not getting Social Security, that you have to do this, because if you don't enroll in Medicare on time, then, remember we talked about general enrollment before?
Right.
Well, sometimes if you miss that special window, you can only sign up during another certain period of time. Plus, you will have a penalty for not signing up on time. So all of that is really, really critical in making that proactive choice to enroll in Medicare, whether you're working or not, okay? Because if you're working, you still want to get Medicare Part A. It doesn't cost anything. Well, it's prepaid. You're not paying anything.
Don't say it doesn't cost. It's
You might not need Medicare Part B because your group plan is going to cover that in most cases. But I always tell people, talk to your benefits administrator in your human resources department to find out, if you're turning 65, how does my group plan work with Medicare while I'm still working?
And that's a very important thing. And if you got questions on that, call us.
Absolutely.
437-3127. Talk to Joan. She'll answer your questions. We're not going to charge you for that because you got to know what you're going to do. So let's step back a minute. A lot of people, when they are working, have straight insurance plans that have a very high deductible and then have what we call an HSA, a health savings account. We put a lot of money into those. Some people, if you don't get sick, that builds up, you get some interest on it. So now the person hits 65, they go on Medicare. What happens to that HSA account?
That's a really good question, Annalee, and this has come into the news within the last year because this has caught a number of people.
Yes.
When you have an HSA through your group health plan, health savings account, you are the kind of person that should not enroll in Medicare, because when you enroll, and if you're still working, have a group plan with an HSA, if you enroll in Medicare, it can knock you out of your HSA contributions. All right? And there's all kinds of rules surrounding this.
Yes.
If you find yourself in that situation, call me, come in, we'll talk about it and see how it might affect you, because it's a little bit too complicated to go into it here.
Sure.
But basically, if you have an HSA with a group plan, you turn 65, you might not need to enroll in Medicare.
Be careful.
Be careful.
Be careful.
That's right.
Before you make a decision, come in and sit down, talk to Joan. Let's go through some things with you, because it's just like, when do you sign up for Social Security? There is no yes, no answer. When you're doing your financial plan, you need to put these premiums in as part of cost. You need to project that as what you're going to have as part of your monthly expenses. If you opt not to cover some things and you are going to keep money to pay for what they term that donut hole where you got to meet a deductible, make sure you got money set aside to do that. There are just too many variables in this, I believe, for any one company or any offering that's out there to say, oh yeah, here it is, this fits everybody just perfectly.
Definitely.
There isn't, it doesn't happen. It's like I tell people on the financial side, there is no perfect instrument. That's Disney.
That's right.
It's Fantasyland.
Right.
You do the best that you can. So what about, let's cover one more thing because we're running out of time. What about Social Security? We all like when we get a cost of living increase on Social Security, those people who are on it. What does that do to your Medicare Part B premium?
Well, this is really interesting because at this time of the year you start reading everything in the news about the drastic increase in Medicare Part B premium for the coming year, okay? Nobody really knows what that's going to be at this point because the Medicare Part B premium, how they set it for the following year, is determined by whether or not there's a cost of living increase for Social Security.
Got it.
If there's no cost of living increase for Social Security, the people who are currently on Medicare, their premium stays the same.
Stays the same.
Right?
Okay.
If there is a cost of living increase, even if it's like 0.1%,
yes,
then there's going to be a group of people who are not on Social Security but going on Medicare that are going to pay a higher premium. That's what happened this year in 2016. We don't know if it's going to happen in 2017. If there's no cost of living increase, the premium will stay the same for those of us on
already
Social
on.
Security and Medicare.
Okay.
But anybody who's new to Medicare, we're waiting to hear for 2017 what that premium will be.
Right, and we all know, you know, prior to 2008, our cost of living increases on Social Security averaged out a little bit more than 3%, close to 4%. But you had years when cost of living went up 14, 16%. Now, since 08, we've had years of flat, 0, we've had 1.5s, we've had 3. When I'm doing projections, I'm averaging maybe a 1.5 increase cost of living for Social Security. So, you know, there's a lot to learn. There's more to do. There are things we haven't covered. Will you come back next month?
I'll come back because I really want to continue talking about some of the mistakes people make with Medicare.
And let's prevent them before they happen.
That's right. So
let's
they're
prevent
aware
them
of
before they happen.
That's right.
So watch again next month. If you have questions, please call us 437-3127. Ask to talk to Joan. Joan can help you on the Medicare side. I can help you on the financial planning side. And of course, we have the rest of our team through the Escarosa Senior Alliance. We certainly are here to help you and to bring you to the people that will help make your retirement the most successful. Give us a call, 437-3127. Won't cost you anything. Come see us here in the Pensacola office. Go and see us in the Mobile office. In the meantime, you have a question, please give us a call.
Mainstay Financial Group offers advocacy and personal financial guidance in a caring environment. That's the heart of our practice. At Mainstay, we're dedicated to exemplary service and a caring relationship with our client, not with a number. Plan for the future now with Mainstay Financial Services.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.